Hello and welcome to this video about non-hallucinogenic psychedelic medicines. I'm Dr. Lynn Marie Morski. I'm president of the Psychedelic Medicine Association and host of the Psychedelic Medicine podcast. And I'm really excited to talk about this topic with you today. Now, if you're new to psychedelic medicines, before we get into the non-hallucinogenics, let's start with what psychedelic medicine is. Psychedelic medicine involves therapies that include the use of a psychedelic substance. Now, very often, these also include the use of psychotherapy, sometimes before the use of the psychedelic, during, or after, and very often involving psychotherapy at all 3 points. We tend to call the period of psychotherapy or counseling or other type of intervention before the psychedelic journey preparation. And then after the psychedelic journey, we call that period integration, where your therapist or your integration guide or coach will help you take what you learned during the journey, maybe some insights you got, and help you integrate those into your psyche and into your everyday life, into forming some new habits and some new thought patterns so that you can make the most out of your psychedelic experience. Now, psychedelic medicines very often address conditions that have trauma at the core, like depression, anxiety, PTSD. But as the field expands, psychedelic medicines are also being researched for things that don't have trauma at the core, like stroke or cluster headache. Now, psychedelic medicines are commonly addressing the root cause of the illness. Like I mentioned before with depression, usually something like an antidepressant, the goal of the antidepressant is to address the symptoms of depression, whereas psychedelics are aiming at addressing the root cause. Perhaps it's a trauma, perhaps it's a limiting belief. Whatever it is that's leading to the depression, psychedelics aims at going in and helping the patient reevaluate that core belief or that trauma. And hopefully by addressing that trauma, we can therefore alleviate the disease burden and not have to be chasing the symptoms afterward. Now, just as an overview, some of the most commonly studied psychedelic medicines are ketamine, which is legal in all 50 states. Ketamine is more of a dissociative medicine as opposed to the hallucinations you think of in a lot of the traditional psychedelics. A psychedelic medicine that is likely to be MDMA approved by the end of 2024 is MDMA. This is something that is often known by terms like ecstasy or E or Molly. And it, like ketamine, doesn't produce a lot of hallucinations, but what it does produce is a lot of empathy. Some people call it an empathogen. Really helps with feeling connection. And it is also very effective at turning down the fear centers of our brain so we can address things like trauma without the fear that was associated with the first time that we may have experienced that trauma. Another commonly studied psychedelic medicine is psilocybin. Now, this is the active ingredient in what you may have heard referred to as magic mushrooms. Psilocybin is actually legal for regulated adult use in the state of Oregon. So there is some place here that you can legally consume psilocybin. And it is one of the more hallucinogenic psychedelics. It has let's say a trip or a journey that tends to last 4 to 6 hours. And LSD is kind of a close cousin to psilocybin. It's also very hallucinogenic. This is the substance you may have heard called acid. And it has a journey that tends to last even longer, which is about 8 to 12 hours. Now, there's another psychedelic called DMT. It is the active ingredient in ayahuasca, if you've heard of ayahuasca. Now, DMT by itself is about a 15 to 20 minute journey. But when consumed as ayahuasca, the journey can last 4 to 6 hours. And with ayahuasca, there's very often a purging along with the hallucinatory journey. The purge might look something like vomiting. It may be diarrhea. It may be sweating or shaking. A lot of different ways that the body has of getting out the energies that come up during these journeys. Another psychedelic that is being studied is called 5-MeO-DMT. This substance in its non-clinical form is very often smoked. It is the parotid gland secretion of the desert Sonoran toad, and there's a synthetic version of that as well. Like regular DMT, it is also about a 15 to 20 minute journey. And then finally, we have ibogaine, which is a very powerful psychedelic. Its roots are in an actual root out of Africa called iboga, and that journey can be up to 30 hours long. It is extremely powerful. It also has some cardiac risks. So anybody who is considering undergoing ibogaine needs to go see a cardiologist first to make sure that their heart is in the proper condition to undergo that journey. Now that we talked about some of the most commonly researched psychedelics and what psychedelic medicine is, let's move on to what are non-hallucinogenic psychedelics. Now, even just this term is a little bit controversial because some people feel that to be a psychedelic is to be a substance that has a hallucinatory property. You realize most of the substances we just discussed had some kind of hallucination that came with them. So let's just look at the word psychedelic. The word psychedelic is derived from the Greek words for mind manifesting. So whatever that looks like for your mind to manifest itself, it may be in a hallucination, it may just be in a realization. But if we're looking at, let's say, the Wikipedia definition of psychedelics, they say psychedelics are a subclass of hallucinogenic drugs whose primary effect is to trigger non-ordinary mental states, known as psychedelic experiences or trips. So here in the definition, they're saying a psychedelic is a class of hallucinogenic drugs, right? As if the term psychedelic is interwoven with the term hallucinogenic. So that may make you think like, how can we have a non-hallucinogenic psychedelic? Well, for the purposes of this discussion, we will say that a non-hallucinogenic psychedelic is a psychedelic substance, so something that has the structure or very similar structure to a psychedelic medicine, but that does not have the hallucinatory component. That component has somehow been removed. Very often in the industry that is creating these non-hallucinogenic psychedelics, they refer to these as psychoplastogens or neuroplastogens. And you see in both of those we have plastogen. This sounds familiar. Think about like plasticity, which is a term that we're going to be discussing a lot, which means the ability to form new things, for something to be bendable and movable and flexible and changeable, right? So again, that's a way that a lot of people are thinking about these, is that we're not focusing on the hallucinatory part. We're focusing on what happens on more of a cellular level. Just as a reminder, traditional psychedelics, and those are the psychedelics that have very often a hallucination or dissociation or something like that, there's some relative contraindications to those. And what that means, what a contraindication is something that a patient has, perhaps in their medical history or their psychiatric history, that makes it unsafe for them to undergo a treatment with a hallucinatory psychedelic. Now, let's discuss a few of those. And just so you know, what is contraindicated can be changing all the time as we do more research on these psychedelic medicines. Because at the beginning of research, we want to make sure we are not putting anybody at extra risk. And so we keep a lot of people out of the studies. And for an example, as an industry, have been keeping people with schizophrenia and bipolar disorder, and those with a first-degree relative who has schizophrenia or bipolar disorder, they've been kept out of the studies for fear that psychedelics with hallucinations may cause schizophrenia to have an onset or may cause some kind of manic episode with bipolar. Now, we have recently moved to start doing research on those patient classes, those with schizophrenia and those with bipolar disorder. However, at the beginning, those were contraindications. Now we'll just say they might be relative contraindications or something that a patient may want to further evaluate before diving into a psychedelic journey that has a hallucinatory component. I think it's still a pretty safe bet that somebody who has a psychosis or psychotic disorder is still contraindicated from undergoing something that is going to spawn a hallucination. Something else is if a patient has uncontrolled hypertension. That means their high blood pressure is not under good control. Because if you can imagine they undergo a hallucination, they might see something overwhelming in some way in this hallucination that gets their blood pressure going. This could bring it up to an even further unsafe level. Same with patients who have heart arrhythmias. If you get really worked up in this hallucinatory situation, your heart arrhythmia may go from perhaps mild to a more severe version of that arrhythmia, which would be unsafe. Additionally, patients who have something like dementia, if you are going to undergo a psychedelic journey that has this altered state hallucinatory component, it's important that you've got your therapist guide there and that you have some alliance with that guide and that you've consented to undergoing this altered state of consciousness and this hallucination, which patients with dementia may not be able to have that therapeutic alliance and they may not be able to consent fully to that type of journey. And finally, perhaps somebody has had a psychedelic experience before with a hallucination and they found it very traumatic. They experienced trauma from the psychedelic. It's very possible. The likelihood is less if you are in a situation where you have controlled for the set and setting, which means the mindset going into the journey and like the physical setting that you have. Do you have a safe facilitator? Are you in a safe area? Do you have maybe some nice playlists going in the eye shades and everything is really well controlled? that might lessen the likelihood that you have a traumatic experience, but it doesn't make it zero. It's still possible. And so if a patient has had a previous traumatic experience with a psychedelic, they might not wish to undergo another hallucinatory psychedelic journey. And just a reminder that psychedelics are not without risks. The psychedelics that have these hallucinatory components, there have been side effects. One is called hallucinogen persisting perception disorder, or HPPD. This is something that back in the day, I think was colloquially called flashbacks. However, it's where people continue to see some of the hallucinatory components, maybe visual snow or some flashing lights, long after the psychedelic has stopped taking effect. Another is that it can induce psychosis, or it can induce some bipolar manic episodes. This has been seen in some patients. We know that it can cause nausea and vomiting, especially something like ayahuasca. Like I said, a purgative, it definitely causes vomiting. And so this could be unsafe for people with certain gastrointestinal disorders or esophageal issues, or perhaps with anorexia, if they're already having a lot of issues with their electrolyte balance. And then there is always the risk of lingering destabilization, which means that you went on your hallucinatory journey and may not have come all the way back down into your body for a period of time. If you're interested in learning more about that, I'd advise you to take a look at the Challenging Experiences Project, which looks at a lot of the negative effect that people have reported after having psychedelics. And just to state here that the reason that that even exists is because psychedelics are so effective, and so many people, myself included, are touting the benefits of them. But people like Jules Evans, who runs the Challenging Experience Project, wants people to know that there is still a level of risk with these medicines. And he also wants people to be aware and to be well-informed heading into a psychedelic journey. And then the last risk of psychedelic is that, unfortunately, there can be unsafe facilitators. With any practice, the practitioners are human. And we hope that every doctor and therapist and psychedelic facilitator has the patient and the client's best interest at mind, but sometimes that's not the case. And when you're in a hallucinatory journey and you're in an altered state of consciousness, the power dynamic can be even more unsafe. So that is still a risk with the hallucinatory psychedelics. Now, another thing about traditional psychedelics, for all of their benefits, they are still not easy to access because a lot of them have a 4 to 8 to 10 hour journey with them. And like I said, it's best to have a trained facilitator and be in a safe setting. This requires having facilities that can monitor patients, or patients can have, the soft lights and the soft furniture and have all the equipment there to be safe. And you might need 1 to 2 therapists. And then those therapists have to be there for that entire day, generally, with that patient. That makes it really difficult to access for people, both from the fact that they may not have that time off work, they might not have childcare, and also because they may not be able to afford it. Like I mentioned before, psilocybin is now legal in Oregon for adult use, but they're showing that a lot of these journeys with psilocybin are about $2,800 and up for one session. Unfortunately, that's out of the realm of a lot of people. Now, another issue is just a lack of trained psychedelic therapists. There are so many people struggling with mental health issues in our country, and it's still a struggle to get as many therapists trained as we're going to need to address all of these people, especially when the hallucinatory journeys that the therapists have to be present for are an entire day long. Now, how do psychedelics work? As I alluded to on a slide before, psychedelics work at a cellular level, but they also work at a consciousness level. Now, if we're looking at the consciousness level, that is where we have these hallucinations. This is where we have the altered state of consciousness. And in that altered state, and during those hallucinations, you may see things, you may have realizations. So they might come to you like, oh, I didn't realize that this pattern of behavior that I have now is related to this childhood trauma, or I think my depression might be coming from this limiting belief that I keep telling myself about myself. You may be able to address trauma, perhaps from your childhood, and you may also uncover trauma that you didn't know was there. And very often in these states, people have an immense feeling of connection. They often feel connected to themselves, to their family, to their friends, to nature, to the universe as a whole. There's just very often a feeling of overwhelming connectedness. Now, something else that may happen is that people get what they often refer to as downloads. This is kind of like those realizations I said before, where suddenly just like this lightning strike of, I need to leave my job and pursue this other career, or I think that I need to spend more time on my passions or my hobbies. Those kinds of things can just come out of nowhere. They feel like you just downloaded some piece of information that is therapeutically very helpful for you. And then also there's what scientists and researchers very often call the mystical experience, where perhaps people feel they are one with God, or they've met a deity and they end up having this otherworldly experience. They've encountered some angels or some ancestors. All of those are possible on the consciousness level. Now, on the cellular level, there are a number of things that seem to be consistent throughout most of the psychedelics. A lot of the psychedelics increase something called neuroplasticity. In addition, a number of the psychedelics can increase neurogenesis. A number of the psychedelics are anti-inflammatory. Some are also what we call anti-nociceptive, which is anti-pain, pain-relieving psychedelics. And then, in addition, there's an increase in brain connectivity. If you've ever seen the image that came out of Imperial College London that showed placebo on one side and psilocybin on the other, it showed the brain connectivity under psilocybin is about 5 times greater than the brain connectivity with placebo. And that makes so much sense why suddenly you would be able to make connections and see why, oh, this trauma is related to this current situation I have, or oh, perhaps this limiting belief is leading to this depression. It's because so many different areas of your brain are connecting that are not normally connecting. Now, let's break down each of these cellular level processes a little further. The first one I mentioned is neuroplasticity. Neuroplasticity is the ability of the brain to form and reorganize synaptic connections. Now, think about when you were a child and your brain was like a sponge. You were learning new languages. You were learning how to walk and crawl and eat and interact with the world, all so much more easily than if you tried to learn a new language now as an adult. That's because there are these developmental critical learning periods where we're very sensitive to input from our environment. Usually these periods close in adolescence, somewhere between 7, 8, 10, but psychedelic researchers have found that psychedelics have the ability to reopen critical learning periods, inducing a state that's very similar to this childhood neurodevelopment. These periods, depending on the psychedelic, can be reopened between 48 hours and 4 weeks. This is a full month where your brain is taking in new information much faster and able to incorporate that and use it much more easily like it could when you were a child. And this is believed to be one of the primary mechanisms of why psychedelics are so effective, especially if really trained, skilled psychotherapists are working with a patient during that period. Imagine if you had some maladaptive thought pathways, you undergo the psychedelic, your brain is ready to learn new, more adaptive ways of thinking and adaptive ways of moving in the world and interacting with your friends and your partners and your coworkers. That's a really effective way to make the most out of your psychedelic journey. Now, you may wonder, how do psychedelics induce this neuroplasticity? Now, neuroplasticity has different aspects, and we're going to go through each of these individually, don't worry. But some of them are dendritogenesis, synaptogenesis, neurogenesis, and also there's expression of plasticity-related genes, like something called brain-derived neurotrophic factor, or BDNF. The first one I mentioned is dendritogenesis. Now, dendrites are the projections that come out of the cell body of neurons, the cells that are in our brain and nervous system, and their main function is to receive information from the other neurons and the environment. Dendritogenesis, which I said psychedelics are helpful with, that is where the growth of these dendritic trees branch out and receive more information. Now, synaptogenesis is the process of forming synapses between these neurons, which again, all of this is related to how connection and communication are improved between neurons. And neurogenesis, finally, that is the growth of new neurons. So if you've imagined somebody who suffered something like a stroke, where a blood clot cut off blood supply to a part of the brain, and then those neurons in that area died, this is where something like neurogenesis can be very effective and life-changing if we could regrow neurons in that part of the brain. Now, in psychedelics, where does this neuroplasticity tend to happen? There are 2 main parts of the brain that they've seen the majority of the neuroplasticity. The first is the prefrontal cortex. And the prefrontal cortex plays a role in the regulation of complex cognitive, emotional, and behavioral functioning. Now, you're probably already seeing where this could be effective in treating something like depression or anxiety, right? We're dealing with the cognitive center, the emotional center, and behavioral functioning, so how we relate to people in the world. And the other area that they found neuroplasticity to be prevalent in is the hippocampus. Now, the hippocampus's primary function is to transfer short-term memories to long-term storage. So you learn something new. For you to be able to remember it tomorrow, it had to be transferred to your long-term memory by the hippocampus. The hippocampus is also involved in learning and emotion, and it plays a role in emotional processing, including anxiety and avoidance behaviors. See where that would also be very helpful in addressing things like anxiety. Now, neurogenesis, as I was mentioning before, which is the growth of new neurons, both DMT and 5-MeO-DMT have been shown to be effective at promoting neurogenesis. In one study, DMT promoted the generation of new neurons in the hippocampus specifically, which enhanced adult neurogenesis and improved spatial learning and memory tasks. In another study, a single dose of 5-MeO-DMT led to cell proliferation, neuronal survivability, morphological and functional changes in adult mice in their ventral dentate gyrus. So both of these have shown the ability to grow new cells and improve their survivability. As I mentioned before, psychedelics have been shown to have some anti-inflammatory properties. You have probably heard so much about how inflammation is playing roles in diseases that we never thought of before, right? We thought, oh, we can see that there's redness on our skin from where we've got an infection. That's inflammation. But in the past years, we've been discovering how much more inflammation plays a role in things like stress, depression, wearing down of different body systems. And it's having an overall effect in ways that we never realized before. So for psychedelics to be anti-inflammatory is another impressive feat. And the way they enact this anti-inflammatory property is through activation of the serotonin receptor. Now, as far as the anti-nociceptive effects or the anti-pain effects, first off, obviously decreasing inflammation can help reduce pain. Think about when we're in pain, we often take an anti-inflammatory medicine, right? Same thing here. If we decrease the inflammation through that activation of the serotonin receptor, we may also be decreasing pain. But in addition to that, psychedelics can also do it on their own through activation of the serotonin receptor in a different way. Several neurophysiological responses result in the disruption of the functional connections in the brain regions that are associated with chronic pain. So then after that disruption, healthy reconnections can be made through that neuroplasticity effect we talked about earlier, which can result in sustained pain relief. Now, this process isn't fully understood and the evidence is limited, but this is what they're thinking so far. And studies have been done on psychedelics involving patients who have suffered from things like phantom limb pain after an amputation, cluster headaches, which are very, very painful headaches, fibromyalgia, spinal cord injury, complex regional pain syndrome, and lumbar radiculopathy. Now, you may be wondering, how are non-hallucinogenic psychedelics made? Well, I have to admit, it's a little bit above my knowledge as I am not a neuroscientist, but what I can say from what the research has come out is that it appears that they are attempting to have psychedelics attached to just one of the pockets in the serotonin receptor instead of both of the pockets in this certain part of the receptor. And with that, they are finding that they can get some of the antidepressant effects and the other effects that have been beneficial without the hallucinogenic effects. So now let's discuss some of the non-hallucinogenic psychedelics that are under research at this time. By the way, just a reminder, none of these are currently available to the public. They are currently all in clinical trials or other type of research studies. The first we're going to discuss is a non-hallucinogenic LSD analog. This one is called 2-BR-LSD, and they found that it induced dendritogenesis, which we talked about earlier, and it increased active coping behavior and reversed chronic stress in mice. There is also a non-hallucinogenic version of ibogaine. Now, if you remember, ibogaine is that powerful psychedelic that I said could last up to 30 hours or more, and it also has the safety concerns of possible cardiac toxicity and the proclivity for inducing cardiac arrhythmias. So they tested an ibogaine analog called tabernanthalog, or we'll call it TBG for short, which is a water-soluble, non-hallucinogenic, non-toxic analog of ibogaine, and they found that it promoted neuroplasticity, reduced alcohol and heroin-seeking behavior, and produced antidepressant-like effects. Now, the actual ibogaine, the one with the hallucinations and the long journey, it has been shown to be very effective for opioid use disorder. But if you see here, TBG also reduced heroin-seeking behavior. So imagine the possibility of having the effects of ibogaine without that 30-hour journey. There was even one study in which a psychedelic analog without hallucinations outperformed the hallucinatory version. This was with a psychedelic that's called DOI. It's not one of the more commonly researched ones, so I didn't bring it up at the beginning, but I just wanted to point out that sometimes the non-hallucinogenic version can outperform them. And in this specific study I'm referring to, the DOI that came with the hallucination did not show antidepressant effects. However, the non-hallucinatory version did. And similarly, the non-hallucinatory version showed fewer neural impacts in a negative way. There were some negative neural impacts from the hallucinogenic version that were prevented with the non-hallucinogenic version. Now, you may be wondering, why would we want to use a non-hallucinogenic psychedelic? Well, as you recall, I mentioned at the beginning that there are a number of people for whom psychedelics with a hallucination are contraindicated. So these non-hallucinogenic psychedelics could be the first-line treatment for those patients so that they could still get some of those cellular effects and the cellular benefits of a psychedelic without the danger to their safety. And also another possible use of non-hallucinogenic psychedelics could be to extend the effects after a hallucinatory psychedelic journey. So it may be that in some cases, a hallucination would be required to incite an effect like an antidepressive effect, but perhaps we could extend those antidepressive effects without another hallucinatory journey. Perhaps just on the cellular level, we can interact that neuroplasticity or spur on that neurogenesis, and we could boost those effects. Because with something like ketamine, we've seen it be very effective if they have 6 sessions over 2 or 3 weeks, but then very often a booster might be needed a couple of months or a year down the road. This could be one of those situations where they've put in the time and work to go through these longer hallucinatory journeys, but if we could give them a booster without having to do that again, that'd be very advantageous on a number of facets, like the time that they have to take off work and the payments that they would have to do for a therapist. Now, this is a good time to remember that psychotherapy is still a really important adjunct to these therapies. Like we talked before, if you're opening a critical learning period and your brain is in this neuroplasticity phase, you want to do the most with it. And at that point, it's best to undergo psychotherapy with a skilled psychotherapist who can help you retrain your brain to some adaptive patterns and hopefully decrease the depression at its core so you won't have to be chasing the symptoms later. Now, another benefit of these non-hallucinogenic psychedelics is that they're an unlikely potential for abuse. Now, this is a good place to point out that the vast majority of psychedelics cannot be abused because they are not addictive. They can be overused. Somebody can say, oh, I really like taking psilocybin, and they can take it day after day, but there isn't a physiologic addiction to it because eventually it just stops working. Now, with these non-hallucinogenic psychedelics, there wouldn't even be that desire to be taking them every day because there's not some kind of potentially fun hallucinatory journey to go on. There's no escapism involved, which definitely decreases the potential for abuse. This would also decrease the potential for diversion. And diversion means this, getting a drug for one use and then selling it on the street for something else. This is more common we see in things like Adderall or opioids. I don't think there's going to be a big street market for the non-hallucinatory psychedelics because, again, there's no escapism. There's no altered state of consciousness. They probably won't feel much of anything. So that's another benefit. And then another benefit still is that a lot of the hallucinatory psychedelics do come with a lot of nausea. And there's a potential that with the way that these new non-hallucinogenic ones interact with the serotonin receptor, they may be less likely to cause nausea because they interact a little bit different with the circuitry. Now, another good use for non-hallucinogenic psychedelics is for those conditions that I talked about at the beginning that don't actually have trauma at their core and where there's no correlation between the intensity and the hallucinatory level of the psychedelic journey and the effect. Because there have been studies showing that those who have a more mystical experience or altered state of consciousness do end up having a greater, let's say, antidepressant effect if that's what they're going for. So in those cases, it may be that a hallucinatory journey is the most effective way to address their depression. But if we're talking about something like stroke, where we just need to regrow the neurons in the affected section, there's not going to be a correlation between the intensity of the hallucination and the effect. And also the same has been shown with migraines. And so what a great use of non-hallucinogenics for the instance where the hallucinatory component doesn't actually have an effect. Then we can just go straight to the healing components at the cellular level. Another important use for non-hallucinogenic psychedelics is in creating individualized treatments for everyone. You don't want a situation where we have all different types of nails and we have one hammer, right? Everybody is very different. Dosing needs to be different. Hallucination levels need to be different. Lengths of treatment need to be different. And so it's great to be creating different types of psychedelics that work for different people. And then also different people may need different types of psychedelics at different points in their healing journey. As we suggested a minute ago, perhaps at the beginning, it is advantageous to have this large hallucinatory mystical experience. But if that isn't necessary later in the journey, how great to have this other option that takes much less time of the patient, time of a therapist, requires leaving work, going to a facility. If we have a much easier option like these non-hallucinogenics that can kind of boost those, it's great to have them at different points in the healing journey? And then also, what if these non-hallucinogenic psychedelics could be used to prepare somebody for a hallucinogenic psychedelic journey? There are some people for whom the thought of undergoing a psychedelic journey is entirely too frightening, and it may be because of a past trauma, or it may be because of intense anxiety. What if we could use these non-hallucinogenic psychedelics to help them address that trauma or address that anxiety and get them to a place where they now feel safe to undergo a more hallucinatory journey? Maybe another benefit of this non-hallucinogenic psychedelics. Just to give a short list of what non-hallucinogenic psychedelics are currently being studied for, we have anxiety, depression, PTSD, migraine, substance use disorder, hearing loss. Think about it, we're growing new nerves. Stroke, Dravet syndrome, epilepsy, pain, depression and anxiety and Alzheimer's disease, schizophrenia, bipolar disorder. And there, I'm sure, will be a number of others in the near future. Now, there's been some discussion within the psychedelics community as to whether or not a trip is required for healing. And I think that general question needs to be broken down further, because there are many different types of healing, many different types of patients, and many different points on a healing journey. And also, I think it depends on what we're trying to address, right? So as we mentioned a minute ago, perhaps there are some things for which a mystical experience are required, but there are probably a number of others, like we were discussing with stroke, where it's not required. And just a word about something that I've seen a lot in the psychedelic space is people who have what I refer to as a case of psychedelic elitism. They think psychedelics should only come as they were initially created with the journey, and there's no other reason to have a psychedelic. And to me, unfortunately, that's very short-sighted, because that is not taking into consideration all those patients that I said for whom a psychedelic is currently contraindicated. To me, it begs the question, who doesn't deserve to experience healing through psychedelic medicines? I firmly believe that this shouldn't be an either-or situation. Either psychedelics come as they came before with all the hallucination, or there's nothing. I think this should be a yes-and situation. Yes, we need our hallucinatory psychedelics. Yes, we need our non-hallucinatory psychedelics, because healing through psychedelics should be available to everyone, regardless of condition that you currently have, mentally or physically. Everybody should be entitled to this healing. So for me, I am very happy to see the research that's being done into these non-hallucinogenic psychedelics to bring healing to a wider range of people.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.